The top stories tonight in Y News. The community quarantine alert level system for the National Capital Region on September 16 has yet to be determined by the government.
Presidential spokesperson Harry Roque apologizes to healthcare workers after losing his cool during a meeting. But the medical community is now calling for Secretary Roque's resignation.
The Quezon City local government will conduct surveillance in close-setting facilities following the COVID-19 outbreak in an orphanage.
Pharmally assures COVID-19 positive individuals can vote in the coming 2022 election.
The Taiwanese government has transformed thousands of tons of agricultural waste into something useful and an income-generating industry.
Exposure to noise from traffic roads, and railways over a long period is linked to a higher risk of developing dementia, according to studies.
Good evening, Philippines and the world. Today is Friday, September 10, 2021. Join us in the next hour as we deliver today's top stories around the country and other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media account and our website, untvweb.com. I'm Angelo Castro III.
First in the news. To address the current COVID-19 surge in the Philippines fueled by the more transmissible coronavirus Delta variant, a new quarantine strategy will be enforced by the government. Metro Manila will be under a new quarantine strategy beginning September 16. However, Malacanang has yet to determine which alert level system will be implemented in the country's capital region. Rosa Licos will tell us why.
Quarantine restrictions in the National Capital Region will only be either enhanced community quarantine or general community quarantine with alert level system. The implementation of the new alert level system scheme will be piloted in Metro Manila on September 16 to 30, 2021. The guidelines have been provisionally approved by the Interagency Task Force against COVID-19. However, it is not yet clear what alert level system will be declared over the National Capital Region.
Ito po, in the spirit of transparency. Issue number 1, ilalagay ba sa alert level 4 ang Metro Manila na bawal pa rin ang dine-in, personal services at mass gatherings? Or may mga nagsasabi na dahil mataas na naman po ang nabakunahan sa Metro Manila, gawin natin ang ginagawa sa ibang bansa. Basta meron silang vaccination, po pwedeng limited dine-in, po pwedeng limited al fresco. So mainit po ang debate dyan at hayaan po nating umusad yung proseso ng debate.
Under the new strategy, industries, activities, or establishments are classified to 3 Cs. This refers to close, crowded, and close contact. Under Alert Level 4, operations of any kind of activities will not be allowed, such as religious gatherings, restaurant, dining services, personal care services, among others. Under Alert Level 3, activities and industries are allowed at 30%, while under Level 2, 50% capacity and full capacity under Level 1.
Ginagawa po natin ito because ang una nating hangarin ay makahanap ng matibay at maayos na pamamaraan para talaga mapigilan ang pagdami ng COVID-19 at isa dito ang pagpipigil ng paggalaw ng tao, lalo na yung mga asymptomatic na maaaring makapagdala o makapagkalat ng COVID-19.
Granular or localized lockdowns will only be declared in specific areas with case clusters such as one house, one street or district, one building, one floor building, or up to one barangay. No one is allowed to go out of the area except health workers, inbound and outbound overseas Filipino workers, as well as those with medical emergencies. The local government unit will intensify active case finding, testing, and isolation. Apart from the alert level in NCR, IATF still has to discuss thoroughly the proposal to impose vaccine bubble and criteria for alert levels. The Department of Health will announce the alert levels in Metro Manila every week, while the local government units will implement it. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the number of patients calling the government's One Hospital Command Center continues to increase. However, COVID-19 referral hospitals in the country remain congested. Marvin Callas will tell us why.
The One Hospital Command Center still records an average of 500 calls per day in the last couple of days. Majority of the calls needs to get admitted in hospitals as they fall under severe and critical cases. The Philippine General Hospital, one of the country's largest COVID-19 referral center, is now operating in full capacity, which exceeds its 300-bed capacity for COVID-19 patients. PGH spokesperson Dr. Jonas Del Rosario said the hospital has at least 100 COVID-19 patients lined up waiting to get admitted. Furthermore, patients in provincial hospitals are often admitted in neighboring regions due to lack of facilities and medical equipment.
Nagkakaroon ng interregional referral madalas, no? So kapag hindi talaga malayong ospital na mare-referan po, ang ginagawa po natin is to always coordinate pa rin with the LGU to monitor the patient and to also provide, no, the transportation for the patient. Then we will coordinate with the other regions, no, para ma-facilitate po yung transfer and at the same time ma-facilitate din yung referral to their receiving hospitals.
Dr. Marilyn Padlan of the One Hospital Command said that regions under full capacity needs additional healthcare workers including medical supplies and equipments.
Depende po yan sa kaso po ng pasyente, sa location ng patient at sa vacancy din po ng hospitals, no? Kasi ang hospital bed naman po ay hindi lang naman literal na kama, it includes also the manpower. And it also includes, no, the supplies, the medicine, the O2 supply po, no. Ibang bureau po, no, yung nag-handle ng mga needs ng hospital. Doon po nila dinadaan yung mga needs nila. Pero usually ang sinasabi naman po nilang mga needs ay mga manpower, medicine, and O2 supply na bibigyan naman po or napapadala naman po nila yung request nila, yung needs sila dun sa bureau natin sa DOH.
Regions having difficulty in patient admission due to exhausted bed capacity includes Region 1, 2, and 3, 4A, Caraga, and the Cordillera Administrative Region. Marvin Callas, UNTV News and Rescue. We serve the people, we give glory to God.
Following the leaked video online of presidential spokesperson Harry Roque losing his cool, the official acknowledged his outburst and apologized for his reactions. However, groups of healthcare workers are asking him to resign from his post. Aiko Miguel will tell us why.
A video of the Interagency Task Force meeting leaked and was reposted by the Philippine Daily Inquirer. One footage shows how Philippine College of Physicians President Dr. Maricar Limpin became emotional as she was pleading to the Interagency Task Force to heed to their call for a hard enhanced community quarantine. On another video, presidential spokesperson Harry Roque was seen having an outburst toward a group of healthcare workers. This earned the ire of many groups as well as of netizens. For his part, Secretary Roque was quick to apologize for the incident.
Kinukumpirma ko po, no, na tayo po ay naging emosyonal at pasensya naman po kayo, tao lamang. Doon sa rekomendasyon ng dalawang doktor, si Dr. Limpin at si Dr. Dance, na mag-impose ng hard ECQ lockdown. At naging emosyonal din po si Dr. Limpin at napaiyak. Doon po ako naging emosyonal.
However, Secretary Roque maintains his position that he was just advocating for the Filipino people who would go hungry if stricter restrictions continued. But Dr. Limpin insists it was not the way Secretary Roque should treat them.
Is not an action that is expected from a government official. And Secretary Roque has to realize that as a spokesperson of the president, then he is basically representing the president. Therefore, any actions that he makes, it is reflective of the president.
Dr. Limpin also said that Secretary Roque's apology should not just be directed to those who attended the IATF meeting, but also to the entire medical community.
Nag-apologize siya, then I think he should hindi parang sinasabi niya if I have offended anyone. So it is directed to a single person or maybe a number of persons only. Dalawa kami ni Dr. Tony Dance na naroroon. So maybe he is referring to the two of us, but he has to understand that we were there as representatives of the healthcare workforce. And therefore, if he has to apologize to the whole of the healthcare workforce. Hindi sa amin lang. Kasi yung ginawa niya is against all of us in the healthcare sector.
As a result of the incident, healthcare workers are now calling for Secretary Roque's resignation.
His behavior is uncalled for. Parang hindi tama eh. He's a lawyer, he's a spokesperson. He should stay cool. Nagbibigay lang ng payo ang mga health professionals. Pagkatapos, ganun ang sasabihin mo. I've seen these doctors, they have been working so hard. And nakalagay ang buhay nila at risk. Sila nga ang dapat tinatanong natin eh. Pinakikinggan natin.
Si bin kasi talaga si spokesperson Roque na nagbibigay ng mga hindi magandang salita against sa mga health workers. Kaya hindi magandang ehemplo.
Nakakapikon na rin, nakakagalit kung ginagawa ni Secretary Roque. Ang dami na ng mga statement na anti-health workers. Kasi last week, parang sinabi niya, saan kayang planeta itong mga health workers na ito. Ngayon, nagbibigay lang ng question yung ating mga doctors. Bakit mo nilalait yung mga doctors na ito? Na in fact, magagaling ng mga doctors. Mga question lang ang gusto nila.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health is now coordinating with different suppliers who can source tocilizumab from Iran. The DOH has also sent a letter to the Swiss embassy requesting to prioritize 30,000 vials of tocilizumab for the Philippines. Some hospitals like UPPGH and National Kidney and Transplant Institute are already running out of tocilizumab. The DOH already warned those who have been offering overpriced tocilizumab and those who are selling it in the black market. The Quezon City local government will conduct COVID-19 surveillance in closed-setting facilities in the city following the reported COVID-19 outbreak in an orphanage. The QCLGU reminds the management of closed-setting establishments to immediately report to authorities whenever suspected cases of COVID-19 infections arise. Janice Inhente details why.
The Quezon City government will increase its swab testing and contact tracing in closed-setting facilities and establishments in the city. This comes after 99 children and 23 staffs of the Gentle Hands Orphanage in Barangay Bagong Buhay got infected by COVID-19.
Marami tayong mga closed facilities for the vulnerable sectors dito sa Quezon City, katulad ng hindi lang orphanage pero nursing homes or homes for the elderly or kahit yung mga rehabilitation centers para sa ating mga persons who are trying to get well from their addictions. These are closed facilities with vulnerable persons inside, and kailangan talaga itong mga naandito, dapat sana ay maging mas maingat ang mga tagapangasiwa ng mga lugar na ito. Talagang kailangan nila talagang mag-practice ng minimum health standards to protect the populations inside kasi mas mabilis ang pagkahawa.
The local government has already sent medicines, vitamins, hygiene kits, face masks, and food packs to the said orphanage. Meanwhile, Gentle Hands Orphanage denied reports that an asymptomatic person visited their facility that resulted to the outbreak. The Quezon City LGU suspected that the infection may have been brought by 3 staff members who went out on August 13 to get vaccinated. The children are currently isolated inside the facility while being monitored by the barangay authorities and the City Epidemiology Surveillance Unit. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines today listed 17,964 additional COVID-19 cases, bringing the total number of confirmed cases to 2,179,786. 170. In its 4 p.m. bulletin, the Department of Health, or DOH, said the latest figure pushed the country's active cases to 175,470. Of the active cases, 87.8% are mild, 7.8% are asymptomatic, 2.48% are moderate, 1.3% are severe, and 0.6% are in critical condition. The DOH noted in its report that all accredited testing laboratories in the country were operational on September 8, but 4 failed to submit data on time. Government data also show that 9,067 more patients have recovered from the disease, bringing the total recoveries to 1,969,401. The death toll climbed to 34,899 with 168 new fatalities. Meanwhile, the overall global COVID-19 caseload has reached to 223,233,869, while the deaths have surged to 4,606,927, according to the Johns Hopkins University. The U.S. is the worst-hit country, with the world's highest number of cases and deaths at 40,602,892 and 654,598, respectively, according to the CSSE. In terms of infections, India follows in second place with 33,174,954 cases and 442,009 deaths. In terms of deaths, Brazil comes second with 585,174 fatalities and 20,958,899 cases. The other countries with more than 7 million confirmed coronavirus cases are the United Kingdom and Russia. COVID-19 positive patients can still vote in the upcoming 2022 elections, assures the Commission on Elections. The poll body is also conducting a bidding for additional vote counting machines. Ray Pelayo details why.
The Commission on Elections today said they are already looking for ways and means on how coronavirus positive individuals can still exercise their right to vote during the May 2022 elections. During COMELEC's budget deliberations in the House of Representatives, Chairman Sheriff Abbas was asked if voters with COVID-19 can still vote in the coming polls.
Pwede po ba bumoto ang isang confirmed positive registered voter sa May 9 national and local election, Mr. Chairman?
Pwede po silang bumoto, but gagawan po namin ng paraan na magkaroon ng parang isolation center sa bawat polling centers. So ihiwalay po natin sila just in case they will be confirmed, and then doon natin sila pabobotohin doon sa isang isolation center.
But Abbas clarified that members of the Board of Election Inspectors who will test positive for the virus will immediately be replaced. The poll body is now working on how to reduce the number of voters from 1,000 per clustered precinct to 800 by purchasing additional 10,000 vote counting machines. This measure aims to minimize the possibility of COVID-19 transmission.
Titingnan natin kung magpo-proceed po kami sa second bidding. Pero kung hindi po, mag-stick po kami sa 97,000. So ang mangyayari po, 1,000 per clustered precinct po tayo.
Meanwhile, COMELEC has no plans to extend the voters' registration as it already reached 4.9 million new registered voters. This exceeds their target of 4 million new voters. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Land Transportation and Franchising Regulatory Board relaunched the service contracting program, but the agency requires participating public utility vehicles to reapply for the Phase 2 of the program. Asher Kadapan Jr. tells us why live. Asher, go ahead.
The service contracting program of the Land Transportation, Franchising and Regulatory Board and the Department of Transportation is back under the 2021 General Appropriations Act. Having a different source of fund and few changes in the system, the Phase 2 of the program will be under a new contract. Thus, The operators and drivers across the country who have previously registered in its first phase under the Bayanihan law are obliged to reapply for the service contracting program.
May database na po tayo niyan, ano? So we have invited them again to participate. Pero kailangan po nila mag-apply muli kasi kailangan nilang pumirma ng mga bagong kontrata. Kasi ibang pondo po ito na kailangan natin yung mga dokumento kung saan kakailanganan natin for purposes of payment.
The government allotted 3 billion peso fund for the service contracting program effective until December 2021 or until the fund is exhausted. Under the program, the PUV operators and drivers will receive incentives based on the number of trips that they have completed each week, regardless of the number of passengers. This provides sustainability on the PUV personnel's end, affected by the low volume of passengers due to restricted mobility amid the pandemic. The program also aims to ensure dependability of public vehicles to frontliners who require commuting between their homes and workplaces.
And it will be monitored through the Center for PUV Monitoring System, of which we have the database of all the units which were issued special permit that are running now in the EDSA busway. Ganon din po ang mangyayari sa ibang mga ruta kung saan pwede silang monitor through GPS, no? In other areas in Metro Manila as well as in the regions po.
Diego, public commuters, particularly health workers and authorized persons outside of residence, on the other hand, will benefit from the program as they will still be able to avail a free ride nationwide starting Monday, September 13. Diego.
Thank you, Asher Kadapan Jr., reporting live.
In other news, a lawmaker expressed his disappointments on the Department of Trade and Industry's allocated funds for the government's assistance to small business owners who have gone bankrupt due to the COVID-19 pandemic. Nel Maribuhok will tell us why.
The Department of Trade and Industry has around 4.5 billion pesos in total assistance for micro, small, and medium enterprises that suffered losses due to the pandemic. DTI Secretary Ramon Lopez explained during the budget briefing in the House of Representatives that from the 4.5 billion pesos, around 1 billion pesos is allotted for livelihood kits for 2022. But he said this will only benefit around 500,000 MSMEs owners.
Pag more than 10,000 na ho ang pangangailangan, tulad ho yung iba, ang inihiram ay 20,000, 30,000. So it would be about 500,000 or less. And I agree po, tama ho yung inyong numero na sa unregistered pa lang may 6 million. At ito po yung talagang unang tinamaan dahil ito ho hindi registered, wala po yan, maliit lang kanilang kampuhayan.
According to the DTI, there are around 1 million registered MSMEs in the country while 6 million are unlisted. 2nd District Marikina City Representative Stella Luz Kimbo said that the said budget is not enough to help all local small business owners in the country.
Paano po natin marireverse ang sitwasyon na yan? Dahil nakakalungkot po, napakaraming wasted funds and at the same time, napakarami pong nagsisisarahan ng mga negosyo.
The lawmaker wants to transfer to the DTI some of the unused and unobligated funds from other agencies to assist more businesses. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
Meanwhile, the Philippine Airlines will continue its operations after the U.S. Chapter 11 court approved motions on an interim or final basis for its voluntary restructuring last September 3. This approval marks an important step forward in PAL's recovery plan, which reduces the company's debt by $2 billion. The decision opens the access of PAL to the first $20 million of its Dentier in possession financing, totaling $505 million. The company assures that the service to its passengers will not be affected, as well as the salary and benefits for employees. The chairman of Pharmally Pharmaceutical Corporation has admitted before the Senate Blue Ribbon Committee that it borrowed money from President Duterte's former economic advisor Michael Yang to fund the first government contracts for the purchase of medical supplies. Harleen Delgado will tell us why.
In the fifth hearing of the Senate Blue Ribbon Committee on the purchase of alleged overpriced medical supplies, Wang Chuyen, Pharmally's chairman, admitted they were not financially capable to supply the initial contracts with the government. This prompted him to borrow money from former economic advisor Michael Yang, but Wang did not mention how much they borrowed.
When we received the bid for the PPEs and the BGIs, the quantum was so large, we seek all the resources we could find. And I asked Lincoln to approach Michael Yang to help with the supplies. And
so you ask him to get help in the supply?
And the funding. Because I think he is a successful businessman, a Chinese businessman with a lot of connections in China with all these supplies.
However, prior to this, Yang, through his interpreter, said he did not know about Pharmally and he did not have transactions with the company. According to Yang, he only introduced Pharmally director Lincoln Ong to suppliers.
It's only through the news that he found out that of the existence of Pharmally Pharmaceutical. Initially, he doesn't know of the existence or the whereabouts or anything about Pharmally Pharmaceutical. Later on, they did approach him for some assistance.
However, Ong says Yang acted as their guarantor to Chinese suppliers. Because of this, senators are convinced that Yang has lied to the committee. The committee has moved to cite in contempt Ong and Yang and order them arrested for being evasive with their answers. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Higher wind signals are now hoisted in some localities within northern Luzon as Typhoon Kiko continues to intensify. JP Nunez will give us the details live. Yes, JP, good evening. Go ahead.
Yes, William, Typhoon Kiko maintains its strength as it moves over the waters of northeast of Santa Ana, Cagayan, with maximum sustained winds of 215 kilometers per hour near the center, gustiness of up to 265 kilometers per hour. Tropical cyclone wind signal number 4 is in effect over the northeastern portion of Babuyan Islands and the southern portion of Batanes. Signal number 3 is raised over the extreme northeastern portion of Cagayan, the rest of Babuyan Islands, and the rest of Batanes. Signal number 2 over the northern, central, and eastern portions of mainland Cagayan, the northeastern portion of Isabela, and the northeastern portion of Apayao. While signal number 1 in the rest of mainland Cagayan, eastern portion of Ilocos Norte, rest of Apayao, northern portion of Kalinga, eastern portion of Mountain Province, northeastern portion of Abra, northwestern and southeastern portions of Isabela, northern portion of Aurora. Pag-asa warned against possible scattered to widespread flooding, including flash floods and rain-induced landslides in these areas.
Maging alerto pa rin yung mga kababayan natin sa mga posibleng pagbaha at pagguho ng lupa. Yung mga pag-ulan na dala ni Kiko, pwedeng magpabaa sa mga low-lying areas. Pwedeng magdulot ng mga biglaang landslide sa mga areas na malapit sa paanan ng bundok. Pwede rin pong umapaw ang mga tubig ilog kapag sobrang dami ng ulan ang natatanggap na inyong lugar. So dapat alisto po.
Pag-asa says Typhoon Kiko may leave Philippine area of responsibility by Sunday afternoon or early Monday. Meanwhile, the death toll in the tropical storm Jolina aftermath has reached 14, according to the National Disaster Risk Reduction and Management Council, while 7 are still missing from Catbalogan, Samar. NDRRMC reminds the public to evacuate as early as possible to avoid casualty during Typhoon Kiko. Pag-asa says there are still 8 possible typhoons that may enter Philippine area of responsibility by the end of the year. That is our latest live. Back to you, William.
Yes, thank you very much. JP Nunez reporting live.
And for the news abroad, U.S. President Joe Biden ordered his most stringent pandemic actions yet with a new federal vaccine requirement. Judith Anufente details why.
U.S. President Joe Biden announced stricter measures to increase COVID-19 vaccinations amidst rising cases of the Delta variant. Under the new nationwide rules, all employers with more than 100 staff members must have their workers vaccinated or tested for COVID-19 on a weekly basis. This will affect approximately 80 million Americans.
What more is there to wait for? What more do you need to see? We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin, and your refusal has cost all of us. So please do the right thing.
Large companies must also provide paid vacation so their staff can take time off to be vaccinated. About 17 million employees in medical centers who receive federal Medicare or Medicaid must also comply. Furthermore, those who work in the executive branch and contractors who do business with the federal government must also be inoculated. Violators may be fined up to $14,000. Exceptions will be made for those who cite religious or medical reasons. Meanwhile, those who refuse to be vaccinated will be referred for counseling and disciplinary action, which may involve termination from their roles. President Biden is using more forceful methods as months of promotions have been ineffective in driving up vaccination rates. More than 177 million Americans are fully vaccinated against COVID-19, but confirmed cases have shot up in recent weeks to an average of 140,000 per day. The majority of severe cases and deaths are among the unvaccinated. Judith Ann Fuente, UNTV News and Rescue, USA. We serve the people, we give glory to God.
Australia and Indonesia recently signed a defense and security agreement, including possible joint military exercises. Joselito Liquida will tell us why live. Joselito?
Good evening, Kath. Australia and Indonesia both entered into agreements to bolster the two countries' counterterrorism, cybersecurity, and defense force together. The Australian Foreign Affairs and Defense Ministers met with Indonesian counterparts on Thursday for the first time since the start of the pandemic.
Australia wants to see an Indo-Pacific region that embraces engagement and cooperation over coercion, that upholds the rights and sovereignty of countries, regardless of their size or power. We want to live in a region that empowers all countries, big and small, to engage and to prosper in an open, inclusive, and rules-based environment.
The agreements provide the first opportunity for Indonesian cadets to participate in military training in Australia, giving them the access to Australian academies, according to Prabowo Subianto, the Indonesian Defense Minister. Both countries also expressed their interest in enhancing support for other neighboring nations in the Indo-Pacific region, such as peace and security in the area. Peter Dutton, the Australian Defense Minister, emphasized the necessity for the two countries to be the anchors of cooperation in the Indo-Pacific region. Kath?
Yes, Joselito, is this the first time that Australia and Indonesia are both working together on security matters?
Kath, not exactly. The two countries have close cooperation as early as 1949, also during the 2002 Bali bombings. So it can be considered that the relationship between Australia and Indonesia is wide in terms of law enforcement partnership, countering extremism, including border security. Back to you, Kath.
Thank you, Joselito Liquidor, reporting live. Exposure to noise from traffic, roads, and railways over a long period is linked to a higher risk of developing dementia, especially Alzheimer's disease, a study from Denmark has suggested. Annie Mancilia tells us why, live. Yes, Annie?
Good evening, Kath. Road traffic noise of 55 decibels have 27% higher risk of Alzheimer's disease and up to 24% higher for exposure to railway noise for 50 decibels compared with less than 40 decibels. These findings haven't been confirmed yet, but a study based in Denmark explained possible reasons for associating noise to developing dementia, especially Alzheimer's disease. This includes the release of stress hormone and sleep disturbance, leading to a type of coronary artery disease, changes in the immune system, and inflammation, all of which are seen as early events in the onset of dementia and Alzheimer's disease. The researchers estimate that out of 8,475 cases of dementia registered in Denmark in 2017, 1,216 of them could be attributed to these noise exposures. The study indicates a great potential for dementia prevention is through reduction in traffic-related noise. About a fifth of the European population is exposed to transportation noise above the recommended level of 55 decibels, making it the second worst environmental risk factor for public health in Europe. Earlier studies have consistently linked a noise pollution to various diseases and health conditions such as coronary heart disease, diabetes, and obesity. Kath?
Thank you, Annie Mancilia, for that live report. Scientists discovered that taking 10,000 steps a day is not the goal for improving people's health. Nina Boscon tells us why.
A recent study led by the University of Massachusetts supports that taking at least 7,000 daily steps lowers the risk of early death by approximately 50 to 70%. This number of steps is less than what most speedometers suggest as recommended target per day, as there's no scientific evidence to the goal of walking 10,000 steps. The said experiment, which began in 2005, was done by following over 2,000 middle-aged adults from different ethnicity and comparing the health of each individual against the step count they have taken. The study also suggests that the step intensity had no effect on mortality. This means that if two people did the same step count at different speed, it would have the same health benefits. Moreover, according to epidemiologist Amanda Paluch, the team leader of the research, the 7,000 step count per day would be a great goal on improving health, especially for people who are demotivated for not reaching the current 10,000 steps. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
The Ministry of Public Health, together with the Civil Aviation Authority in Thailand, will launch an online platform through the line application called MoreProm. This aims to facilitate domestic air travel and serve as a digital health pass. This health pass is valid for up to 3 years and will have information such as the user's vaccination status, previous RT-PCR or ATK test results, and past COVID-19 infection details. The MoreProm platform was originally used to make an appointment for a COVID-19 vaccination, but was later updated to where a user can report adverse reactions from the vaccine. The Taiwanese government has transformed thousands of tons of agricultural waste into something useful and income-generating industry. Merijo Maleriado details why live. Yes, good evening, Merijo.
Good evening, Kath. In Thailand's Guangtian district, shells of water caltrop crabs, or more popularly known as water chestnut, are being recycled. Discarded shells are being made into a kind of biochar through a process that involves combustion at 1,000 degrees Celsius. Biochar is the waste turned charcoal which can be used to enrich soil, absorb odors, and purify water. It can also limit acidification. Now touted as Guangtian Black Gold, it is currently a popular brand, offering varieties of products from room deodorizers to soaps and masks. Guangtian Black Gold Community Cooperative sells the biochar to the public. In the past, thousands of metric tons of water caltrop shells were discarded or burned in the area annually, causing environmental issues. But after the Guangtian District Office had joined hands with Kunshan University to establish a community cooperative, what was once a waste problem become useful products and at the same time an additional tourist attraction in Tainan province. Kath?
Thank you, Merijo Maleriado, reporting live. And those are the reasons behind the news in other parts of the globe. I'm Kat Maraos, live from Bangkok, Thailand. Good evening.
President Rodrigo Duterte has extended the declaration of state of calamity for one more year due to the increasing number of COVID-19 positive cases and deaths. The declaration will enable the national government as well as local government units to continue to implement the COVID-19 vaccination program and utilize appropriate funds, including quick response funds, to contain the spread of COVID-19. The state of calamity have been extended several times since March 16, 2020. And before we close, we will leave you with a final word, giving glory to God from the book of 1 John chapter 3, verse 18. It says, "My little children, let us not love in word, neither in tongue, but in deed and in truth."
And those are the reasons behind the new September 10, 2021. Reasons we deliver to you as they unfold. Ang mga Locasto III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
Kinukumpirma ko po, na tayo po ay naging emosyonal at pasensya naman po kayo, tao lamang. Doon sa rekomendasyon ng dalawang doktor, si Dr. Limpin at si Dr. Dance, na mag-impose ng hard ECQ lockdown. At naging emosyonal din po si Dr. Limpin at napaiyak. Doon po ako naging emosyonal.
He has to apologize to the whole of the healthcare workforce. Hindi sa amin lang. Kasi yung ginawa niya is against all of us in the healthcare sector.
His behavior is uncalled for. It's parang hindi tama eh.
Consistent din kasi talaga si spokesperson Roque na nagbibigay ng mga hindi magandang salita against sa mga health workers. Kaya hindi magandang ehemplo